direct care practices. And this is a model that can be used for any type of service: primary care, specialties, even telehealth, a med spa. You can create med spa memberships, IV infusion memberships. So I am going to break this down and show you guys how this works. So in a direct care or in a membership type of business, basically your patients, your clients are paying a monthly membership. Whatever that membership includes, you can have different tiers of memberships. So you can, decide if we're going to have like tier 1, tier 2, tier 3, and you can give all of those tiers a different price, or you can have one set price that will cover a variety of services. So let's say, for example, you have a monthly membership for primary care services at $69 per month per patient. And let's say you grow your practice, and say your goal is to grow your practice to about 300 patients. Let's say at your first 100 patients paying $69 a month, this brings you about $7,000 a month. And I'll tell you guys, 100 patients, 100 clients, you can effectively manage that part-time. 200 patients or clients, you're bringing in just a little below $14,000 a month. 300, you're bringing in just below $21,000 a month. And at 500, you're bringing in, at $69 a month, you're bringing in about $500 a month if you implement some type of membership service. Now, your membership, as I mentioned, you can create your memberships however you want them to be. If you want to say, well, I'm going to do a med spa membership, and they pay $150 a month and they get XYZ included, or they get a percentage off all their services. How many of you have a subscription service? Netflix, Hulu, Amazon Prime. Everyone has some type of subscription service. Exactly. All you're doing is taking that same concept. That company is giving you benefits into their membership, okay? And you are getting those benefits, and you agree that you're going to pay X amount of dollars per month or X amount of dollars per year to get those benefits from that subscription service. The same would apply for those healthcare services, or that infusion service, or those med spa services. All right. So jot down a number. Think, okay, well, if I get 50 clients to sign up for this membership, that's going to bring this amount of money. So you can decide what you want to include in your memberships, and then you can decide also what will not be included in your memberships. All right. So everything in my membership, everything is not included. There are some services that will cost additional for my patients, but yet I have a lot of patients, even patients with health insurance, that take advantage of the monthly membership, because what I'm offering them is a value. So what you have to remember, all of you have to remember that you need to offer a value to the services that you're providing. So traditional fee for service. So this would be either an insurance reimbursement or fee schedule. So for traditional fee for service does not mean you have to do insurance reimbursement. You can charge your patients or your clients based on a fee schedule as well. So if you decide, well, I am not accepting any insurance, Dr. Chung, I don't want to get into insurance, well, you can create a fee schedule for your patients. So if you know that it's a very simple visit or a simple service, you would charge $75. If it's more complex, you're going to charge $200. So you can provide services based on insurance reimbursement rates, or you can create your own fee schedules. Again, so this can be done in any type of specialty. You can do this in awful, mobile, or telehealth services. So the example I like to use Medicare reimbursement rate. So let's say a Medicare reimbursement rate is about a level 4 is about $170. So if you had about 50 patients a month, and let's say you were charging on average $170 for a visit, which is not uncommon for healthcare services to charge that rate or even more. Or if you are going to submit a claim to the insurance company at 50 patients a month at a level 4 visit, you're bringing in about $8,500. 100 patients, 17,000. 200 patients, 34,000. 300 patients, $51,000. So, and I'm showing you these numbers because you can actually bring in these numbers. So the average primary care provider bills about $500,000 in insurance reimbursements per year. So for any of you who plan on doing insurance reimbursement, or you plan on modeling your fees based on insurance reimbursement rates, these are the numbers that you can bring in on a monthly basis, bringing in, marketing those patients to come into your business.